So usually I like to talk about products that help people, that help them prevent getting eye disease, that help them see their very best for today and for tomorrow. But unfortunately, there's a lot of products out there on the internet that I see influencers promoting, and there's very little to no scientific evidence that supports their use. And there's a chance some even may hurt people. So in this video, we're going to talk about eye care products that you don't need. Let's take a look. Hey, welcome back. This is Dr. Alan here from the Dr. Eye Health Show, helping you learn all about the eye's vision and finding the best vision products. And today we're doing a little twist on things. We're going to look at the products that you don't need. Really shedding some light on some products that I've seen out there and tried myself that, yeah, I want you guys to avoid it. Don't fall victim to these like marketing schemes. A big part of being an ethical healthcare professional is that we have to promote what has scientific validity or real evidence behind it. So with all products and even treatments that are out there, it's good to have at least some level of question in your mind if something's really going to help you or is it just a bunch of hokum. So the first product we're going to talk about is that of Pinhole glasses. If you've never seen Pinhole glasses before, they're supposed to be a type of sunglasses you put on, and they have these tiny holes in them that are supposed to improve your vision, help you see better without the needing of prescription glasses. There's even outrageous claims that they somehow can reverse your need for glasses, which is, again, complete BS. The whole concept behind Pinhole glasses is true, that a pinhole, a small tiny hole that you look through, can improve your vision. You can even test this at home by making a little tiny hole with your finger. And this helps reduce stray lights that coming in from different directions and can improve your vision somewhat. We even use this in the eye clinic with what's called a pinhole occluder, where we cover one eye and we hold something like a pinhole over the other, and that will, again, at least show us that somebody's vision, if they're having deficits, that deficit is something that can be corrected refraction-wise with glasses, rather than with a true eye disease, something like a retinopathy or a severe cataract, which something like a pinhole occluder wouldn't fix. I did pick up these pairs of pinhole glasses off of Amazon for like $12, just as kind of a gag gift to kind of see what it was like. You can't see very much out of it, your side vision is reduced, and it really doesn't improve your vision that much. So again, not worth the money. I think the only time I would ever put these on is if it was like an Armageddon situation where the end of the world was nigh and I had no glasses or contacts. Maybe it would get you through a pinch, but again, wouldn't recommend it. The second thing you do not need is Visine or Clear Eyes. Really any eye drop that claims it'll get the red out. This is historically something that all eye doctors will tell you, is that those eye drops are not good for your eyes, and they usually end up doing more problems than solving. It's not necessarily Visine or Clear Eyes, the brands, that are the problem. It's just the get the red out drops that they do make and are famous for. And that's because those eye drops have an ingredient in them called tetrahydrozoline or nephazoline. And these ingredients have been around for a long time, and they cause constriction of your blood vessels on the eye, which make your eyes appear more white. The real problems with these ingredients is that they often cause a rebound effect, making your eyes more red, which then you use the eye drops to solve that problem, and then it rebounds again and becomes a vicious cycle. On top of that, if you are having a medical problem, something that an eye doctor like myself wants to see on the eye, blanching those blood vessels may mask the actual problem, and then you kind of throw off our whole process of figuring out what the problem is. Usually if your eyes are red, it's because they're irritated or there's a problem such as an infection or something going on. So although having red eyes may not look very good, it's an important sign for us to be able to see that and really help you. On top of that, the preservatives in these eye drops are usually very harsh and have been found in some studies to cause damage to the glands of the eyelids, leading to severe forms of dry eye. So yeah, you gotta watch out for that. Now, since we're already talking about eye drops, let's talk about number 3, which is Rohto Eye Drops. Rohto is a brand of eye drops that you can buy over the counter. They're just lubricating drops, but they have menthol in them as an ingredient. And this is just something that studies have shown that maybe not be a good idea. Primarily, advertisements that I've seen for Rohto drops are marketed toward people like video gamers and people who are up late at night staring at their computer screen, which makes sense because people who are staring at the computer screens usually don't blink as much and therefore have more problems with dryness. And the whole idea of adding menthol to the eye drops is because the front surface of the cornea is more sensitive to coolness, such as wind blowing across the eye, to make more tears. Except menthol, which does have have a coolness effect, it also causes desensitization. And at least one study that I've personally read did find that using menthol on the surface of rat corneas could cause not just desensitization, but pretty much permanent reduction in your own tears being developed. So using eye drops like this may in fact desensitize the cornea and make your dry eye even worse. Okay, now number 4 is this thing, which is an eye massager. I've in fact tried a couple of different brands of these, and they're fairly expensive. They're like in the $120 US range. The whole point of these devices is that they're supposed to heat up, giving warmth to your eyelids to help with any sort of dry eyes, and then it has kind of a massaging function that massages your eyelids and helps squeegee out any of those oils, and it's supposed to be relaxing. Although these electronic eyelid massagers are built very well, I just don't think they work. The heating element doesn't get warm enough to really heat the oil glands of your eyelids. The heating element is too small, not wide enough to be effectively touching your eyelid. And then the massaging motion of the actual massager that's built into it, although it does feel good on your temples, if you've got like a headache and you're just stressed out, it does feel pretty good there, but I'm afraid that it doesn't really push on the eye correctly. It may even push on the eye too much, potentially increasing your risk for things like glaucoma or may even keratoconus, and that's a corneal disease you do not want to rub your eyes with. And honestly, the funny part is that these even play a music tone to try and help you relax. No. Perhaps it could make it a little bit cooler if they put like Bluetooth in there and you can play your own music, but again, nah. There's way other better warm compresses and things you can find on the market. That, and there's way more published evidence for the treatment of dry eyes using thermal pulsation techniques that are used in your doctor's office. So yeah, way better to go that direction. Next up is that of eye color changing eye drops. There's a lot of people out there who seem to not want their eye color. They want to be able to change it either through something like a surgical means or an eye drop. There are some procedures that I've heard of that can change your eye color, but it usually involves doing an implant or using a laser. Unfortunately, all the cases I've ever heard of usually result in severe forms of glaucoma where people can lose their vision and go blind from. So yeah, not recommended and certainly not approved for here in the United States. As far as the color changing eye drops, the ones that I've seen sold on like Amazon and other places, I would not trust those. There is an eye drop for glaucoma treatment that will prescribe to lower people's eye pressure, and as a side effect, it can cause some issues with the color of the eye. Namely for people with lighter colored eyes, like blue or green, they can make the eyes appear a little bit more hazel, and even potentially, I guess, getting them more brown, but I've never seen anybody's eye color change that dramatically. But these same eye drops can have other side effects, like causing your eyelashes to grow longer. In fact, Latisse, the medication that we'll prescribe to get people's lashes to grow longer, is based off of that medication. But for some people, it can change the fat deposition of around the eyes, causing their eyes to give more of a sunken in appearance, giving them like dark circles and things like that. But there is also the concern of you not knowing what's really put into those eye drop ingredients, like preservatives, that can cause damage and ocular surface disease. So again, don't waste your money on these things. If you're really concerned or want to change your eye color, think about color changing contact lenses. There are some contact lenses on the market that do great for that and look good and are fairly safe for the eyes. But if you're going to go the route of color changing like Halloween contacts, watch out for those ones, because historically they cause terrible infections and can cause permanent complications and vision loss from those things. Another item you do not want to waste your money on is that of eye creams. Now, they do have some eye creams out there that may be helpful temporarily at like relieving under eye bags or dark circles. I've done a few other videos talking about those and how to get rid of them, like actual real ways to get rid of them. But the eye creams can help temporarily. I even tried one out recently at a trade show, but unfortunately, again, it only works for a few minutes to an hour or so, and it doesn't cure the actual problem. The real concerning issue is that with a lot of eye creams that are out there is they have a lot of ingredients in them that can potentially cause damage to the eyelids and even hurt and cause problems like severe ocular surface disease and dry eyes. Really, if you're having bad puffy eyelids and inflammation, you should first see a local eye doctor to make sure it's not an infection or something else going on. And then, of course, making sure you're cleaning your eyelids, cleaning your face very well, and then trying like cold compresses, things like that to control that inflammation. But again, most of the eye creams that are out there, just not worth your money. Don't waste it. Next up is that of blue light glasses, particularly cheap blue light glasses. Most of the blue light glasses that you see that are sold for like the $20 range or something like that, they have almost zero technology in them or any real way to prove that they're doing anything. There is some truth to blue light affecting your sleep cycle, potentially affecting eye strain and maybe retinal damage. There's different theories on that, but right now we're still waiting on more studies to be done to conclusively say if the blue light's really helping you with your eye strain or affecting your retinal damage. There are some good quality blue light glasses out there that have science built into it, that a lot of research has been done to block out the type of light that's coming from digital screens. But by far, most of the blue light glasses companies that I've seen, they seem like they pop up overnight, but they don't really know what they're doing, and they don't really even report the right amount of blue light that they should be blocking. I do wear blue light glasses myself, but I invest in ones that are actually good. So if you want to learn more about all the different blue light glasses out there and knowing more of the science behind it, I do have a video series going over blue light glasses and all that, and I'll put that in the video description below if you want to check it out. But yeah, unfortunately, if you spent like $20 on a pair of blue light glasses on Amazon, probably isn't doing anything. Next up are the As for Seen on TV glasses. I've seen a couple of different ones of these. There's either ones for reading up close, or there's ones that are more like driving sunglasses that are like help eliminate all reflections and glare coming off of oncoming headlights, things like that. None of these glasses really work. They're really just a novelty item. The ones for reading up close are supposed to be able to dial them in. There is a little bit of use for that, and I think if you're really struggling, maybe, but really just buying a couple pairs of different cheating glasses of different powers, that's gonna work even better for you. Just to quickly switch in and off, you're gonna save yourself a lot more money just going that direction. Otherwise, the anti-glare night driving glasses, I've done a video going more in depth on true night driving glasses, but the ones, these As for Seen on TV ones, I've tried them. Don't waste your money. They don't work. You'll get a lot more relief from struggling with driving by getting a good pair of prescription driving glasses with a good quality anti-reflective, cleaning your windshield, things like that. Again, if you want to see my experience using driving glasses and figuring out all that, again, I'll put that in the video description. Now, how about red light and green light glasses? This is kind of one of the weirder things on the market, but there are some scientific studies that have implicated having red light shine on the eyes in improving retinal health, specifically how red light can kind of re-energize mitochondria, a certain cell within your body which is the powerhouse of your body, and making more ATP and creating more energy. And the idea is that if you shine this red light onto the retina, then you can basically reactivate the retina and get it to be healthier and have more longevity. Now, while there are some complications that have come out that implicate this, there's not enough studies to prove any of that on human eyes. And it's certainly not at that point where the United States FDA or any professional organization have been able to conclusively say that yes, this is something that's helpful and that we would recommend. As far as blue light, green light, there are some studies that indicate that looking at these different colors lights and having different lights shine into the eye may affect our mood, maybe affect our sleep cycles, things like that. But still, there just needs to be a lot more research going into this before anybody can really back it. So again, hold off. Don't waste your money. It's something that you can laugh at. Otherwise, I hope you got something out of this video. Maybe you learned something new. Whatever your favorite thing was, drop it in the comment section below. And if there's any products out there that you think are either really helpful or maybe completely bogus, again, let us know in the comments. But hey, thanks for watching. If you enjoyed the video and got something out of it, hit that like button for us and subscribe to the channel if you'd like to continue hearing more information about different eye diseases, their treatments, and finding the best vision products to help you see your best. Thanks for watching. Keep an eye on it, and we'll talk to you soon.